Receiving medical test results can often feel like deciphering a secret code, especially when it comes to complex scans. You might be handed a report filled with technical terms, wondering what they all mean for your health, particularly when dealing with conditions like diverticulitis. It is completely natural to want to understand these findings better, so you can feel more informed about your care journey. When you look at the detailed findings of a CT scan for diverticulitis, you are essentially looking for specific signs of inflammation, infection, or complications within your colon. The report will typically describe changes in the wall of your large intestine, the surrounding tissues, and any fluid collections or abnormalities. Understanding these descriptions helps you grasp the severity and nature of your diverticulitis episode. The core reason CT scans are so effective for diverticulitis is their ability to visualize subtle changes deep within your abdomen that would not be visible from the outside. Radiologists, who are medical doctors specializing in interpreting medical images, look for key indicators such as colonic wall thickening, which signifies inflammation in the colon lining. They also identify pericolonic fat stranding, which is an inflammatory reaction in the fatty tissue around the colon, appearing as hazy or streaky areas. Additionally, they search for fluid collections, abscesses which are pockets of pus, or even signs of perforation, which means a small hole in the colon wall, all of which are crucial for determining the right course of treatment. To effectively interpret your own report, focus on the sections detailing the colon and its surrounding structures. Look for words like wall thickening, indicating active inflammation, and phrases describing fat stranding, which further confirms inflammation. If the report mentions an abscess or fluid collection, this points to a more complicated infection requiring specific treatment. Do not hesitate to highlight these terms before your doctor's appointment. Remember, this information is a starting point for discussion with your healthcare provider, not a tool for self-diagnosis. You can ask your doctor to explain each finding and how it relates to your symptoms and treatment plan. A particularly informative finding often mentioned in CT reports is the extent of pericolonic fat stranding, which can actually correlate with the severity of inflammation. Another important aspect might be the presence or absence of free air, which is a strong indicator of a perforation and typically necessitates urgent medical attention. Some reports might even reference a staging system, like the Hinchey classification, which doctors use to categorize the severity of diverticulitis and guide treatment decisions. These details provide valuable insights into the full picture of your condition. Ultimately, understanding the detailed findings of your CT scan empowers you to be an active participant in your healthcare. By recognizing terms like wall thickening or fat stranding, and knowing to ask about complications like abscesses, you can have a much more informed conversation with your doctor. This proactive approach helps ensure you receive the most appropriate care, leading to better management of your diverticulitis and improving your overall well-being.